Okay, so hello everyone. We're from Study Group Basics 1-2 presentation about exostosis in surfer. So this is our study group members, and from me, my name is Udayana with 3-digit identity number 044. Want to start the presentation from Capture 1, background information. Surfer ear or external auditory exostosis or EAE is a slowly progressive disease resulting from benign bone growth due to chronic exposure to cold water. And this is our objective and also problem formulation from this student project. And lastly, the benefit. The benefit of this student project for medical student include the knowledge of exostosis in surfer starting from its definition, epidemiology, etiology, pathogenesis and pathophysiology, clinical manifestation, diagnosis, screening, differential diagnosis, complication, the correct treatment and management, as well as the prevention and patient education for patients with exostosis in surfer. The benefit of scientific learning is the opportunity to learn more about exostosis in surfer and how to treat it. And lastly, the benefit from the community include increasing knowledge in community to have a better understanding and the appropriate therapy for exostosis in surfer. For the next is continued by my friends.
Good afternoon, everyone. I'm Anison Raini with the last three digits of NIM 110. So, moving on to the definition of exostosis. Exostosis, or surfer's ear, is a benign bony outgrowth from the temporal bone in the ear canal. It can also be defined as reactive lesions generated by recurrent exposure to cold water and air that results to the formation of nodular bony outgrowth of the medial canal. Bony outgrowth itself is induced by chronic inflammation of the external canal of the periosteum. Next.
Hello, my name is Savani with student ID number 2002511083 about the epidemiology of exostosis in surfers. It is thought to be more common in coastal region because cooler climate and colder water exposure increases the prevalence. And it's also said that the cooler the water, the severe the disease is. It's also said to be more common in men, probably due to higher water activities involvement than women. It's common in the third and fourth decades, although it could present at any age. And more than 5 years surfing experience increases the chances of surfer's ear development. That's it from me. Maybe continued by my colleagues. Thank you.
Greetings, I'm Daniela Vanessa Kalista and I will continue the presentation about etiology of the surfer's exostosis. So surfer's exostosis commonly happen in individuals who frequently do aquatic activities. It is typically with repeated cold seawater exposure and wine. This exposure leads to a stimulation of new bone formation by hyperostosis mechanism at the tympanic of the within the external auditory canal. With an increasing frequency and duration of exposure to cold water in years, the lesion will become more severe. The next presentation will be continued by my college. Thank you.
Okay, hello everyone. My name is Igustin Uradesa Satadiksa with the digit of my name is 145. Now I will continue about the pathogenesis and pathophysiology of surfer ears. Although the cause of surfer ear has not been established, surfer's ears are thought to develop because cold conditions increase osteoblastic activity. Osteoblast activity is sparked by inflammation, which is followed by fibrosis and ossification, which result in new bone growth within the external auditory canal. Exposure to cold water on a regular basis over many years gradually stimulate osteoblasts in the temporal bone of the ear, which in turn cause the bony growth to serve as a shield for the tympanic membrane against cold air and water. Okay, that's all about the pathogenesis and pathophysiology. Thank you.
Hello, my name is Irene Carla, and I will explain about the clinical manifestation of exostosis in surfer. The clinical manifestations of exostosis can vary from asymptomatic to hearing loss. In patients with the more progressed external auditory exostosis, the symptoms include ear fullness, reduced hearing, chronic otitis externa, the feeling of water trapped inside the ears, and otorrhea. Exostosis rarely causes direct pain. However, pain is secondary due to chronic infection of the otitis externa that manifests in pain. The conductive hearing loss is also a result of external auditory canal stenosis leading to repeated otitis externa. The exostosis form at the sutural lines of the temporal bone, tympanic bone, and mastoid bone in the bony canal. Exostosis in SURFR shows multinodular masses at the tympanic ring during the otoscopy. The degree of the symptoms affect the size of the masses. The characteristic of the masses is multiple, firm, and often bilateral on the external auditory canals. In the case of large masses, the side of the tympanic membrane can be concealed. The entrapment of cerumen within or behind the exostosis can result in cerumen infection. Next.
Hello, my name is William Alexander Hartanka with the last 3D number of 011. And I would like to explain about the diagnosis and screening of sulfur ears or external auditory exostosis or EAE. The history is crucial in helping to diagnose sulfur ears or external auditory exostosis or EAE. The patient must have endured several years of consistent exposure to cold water, typically by swimming, diving, kayaking, and other water sports. The length of times the patient spent in cold water should be mentioned in the history. Prior to the development of major external auditory exostosis, some studies recommend at least 5 years of exposure to cold water, while others recommend 10 years of exposure. Using an otoscope during a physical examinations, the doctor should be able to see multiple nodular masses at the tympanic ring. Next.
Greetings, my name is Theodore Mansinababan with release digit number 093, and I will explain about the sulfur's ear or exostosis of the ear auditory canal. It usually caused by the benign growth in the auditory ear canal, and this benign growth usually caused by the exposures of cold water. We can find it in the surfers, not only in surfers, but all activities that are exposed to the cold water, such as swimming, diving, kayaking, and many maritime activities. So, many kinds of diagnosis can be diagnosed similar to EAE, based on the otoscopic exam in the ear canal, including EAE itself, the osteomas, cholesteatoma, keratosis obstructions, and oral polyps. So, how we distinguish EAE? We must be careful on distinguish this the symptoms. On osteomas, we're looking for its difference. Is the patient usually exposed to cold water, and it is usually found bilateral and multinodular in EAE. The difference with osteomas, the characteristic is on osteomas is usually pedunculated, singular, unilateral, and positions laterally in ear canal, and most commonly found in external auditory canal. They can also be found in mastoid cortex, facial bones, and mandible. So, cholesteatoma is a cystic mass of keratinized squamous epithelium located in the middle ear. It is usually congenital, or since they were born, and commonly be a result of chronic otitis. Different with the cholesteatoma, keratosis obstructions is built up of keratin in the external auditory canal, and oral polyps are a benign fleshy growth in the external auditory meatus or inner ear, usually caused by the irritations, which can be a result of cholesteatoma, foreign objects, or inflammations from chronic otitis externa. It is very different with EAE, which can be differentiated with the fleshy appearance of it. We can see on the picture below that the EAE it's really look like a bone growth, and it might be different from the fleshy one from oral polyps and tumors. Maybe that is all from the differential diagnosis. Thank you, and next.
Hello, my name is Angie Putikamelia, and here I'm going to explain the complications. The size of the exostosis caused by exposure to cold water affects how serious the issues are for the external auditory system. Hearing loss, otalgia, otorrhea, cerumen infections, water trapping, recurrent otitis externa, mastitis, and tympanic membrane rupture are just a few of the complications of EIE. The symptoms of otalgia, otorrhea, and water trapping are caused by the deposition of cerumen or other debris. These symptoms can be brought on by exostosis themselves if they are obstructing a sizable amount of the auditory canal. Antimicrobial otic drops are the best way to treat otitis externa patients and may be at risk for mastitis in several cases of recurrent otitis externa or when it is ignored. And will be continued by my friend. Thank you.
Okay, hello, my name is Evangelina Vincent Utami Lasterda with 3-digit last student ID number 170. On this occasion, I would like to continue explain about the treatment and management of exostosis in sulfur. So if there are patients with asymptomatic symptom, we can give them treatment treatment and management such as cleaning external ear canal or microscopic ear cleaning by a ENT specialist. And also, we can give administration of corticosteroid and antibiotic drop to remove any entrapped debris or blockage and prevent the propagation of complications such as otitis externa and conductive hearing loss. Meanwhile, if the patient has symptomatic symptoms such as 80% occlusion in the external ear canal and has conductive hearing loss, this is the indication to doing canalplastic surgery. The canalplastic surgery has two methods. The first one is we can use elevating the skin overlying the exostosis and drilling out the bone with a drill, and the second one can approach the bony growth directly from the external auditory canal and remove it with chisel. And it is important when patient has been done canalplastic surgery, is critical not to expose the ear with water in order to avoid infection and complication. Well, that's all for me. The next point will be explained further by my friend, and thank you.
Hello, my name is Sofia Paramita with my last 3-digit ID number 156, and I will be explaining about the prevention and patient education of surfer ears. Increasing awareness by educating and socializing the risk of surfer's ear can be done as a preventive measure. Earplugs is the most common solution to prevent the surfer's ear due to it being relatively cheap and easy to use. Other than earplugs, wetsuit hoods were also proven to prevent surfer ear. Using both earplugs and hoods while in the cold water can maximize the prevention of surfer's ear. Earplugs and hoods can be easily found in sport shops. Other than the prevention, patient education during recovery period after the removal of bony growth procedure is also needed. During this time, water shouldn't enter the ear canal at all. Earplugs should be worn during shower or bath, and swimming nor surfing were not allowed. After it healed, surfer's ear can reoccur if earplugs are still not worn while doing motor activities. Maybe that is all for me. Next slide will be delivered by my friend. Thank you.
My name is Aikurniati with student number 216, and the conclusion of our student project, exostosis in surfer ears means there are benign bony outgrowths from the temporal bone in the ear canal, which is caused by excessive exposure to cold water and cold air, thus stimulate osteoblast, which acts as a protective mechanism. The clinical manifestations can vary from ear fullness, reduced hearing, chronic otitis externa, water trapped, and otorrhea, and can develop to complications such as recurrent otitis externa, mastoiditis, and tympanic membrane rupture. The diagnosis can be held through anamnesis and physical examination, and during the otoscopy, we can find multinodular masses at the tympanic ring, hidden tympanic membrane, and infected theremin. For the treatment, we can do regular cleaning of the external ear canal, corticosteroid antibiotic drops, and canalplasty surgery. For the prevention, we can recommend the patient to use earplugs or wetsuit hoods. So these are our references. Okay, I think that is all from smaller group discussions B6. We apologize if there were any mistaken during the presentation. Thank you for watching.